Hello and welcome. You're watching the Health Talk session by Yashoda Hospitals. Obesity or being overweight is not just a mere cosmetic consideration, but in fact, it's a leading cause for many progressive disorders such as heart attacks, hypertension, diabetes, stroke, and chronic kidney diseases. Obesity is on the rise, with out of every 1 in every 4 individuals is being overweight. So what is obesity and what ill effects it can have on one's health? So let's discuss about obesity and weight loss surgeries in our today's episode. I'm Dr. Lakshmi, and let's welcome Dr. Kona Lakshmi Kumari, consultant surgical gastroenterologist and bariatric surgeon from Yashoda Hospitals, Somajigura. Welcome to the program, ma'am.
Thank you for inviting me to this show.
So doctor, according to a recent survey done worldwide, it says that out of every 4, 1 individual is going to be obese in the coming years. So what do you have to say about this and what implications it can have on the global health?
The recent IFSO has issued a notice saying that according to the survey worldwide, they have said that 1 in every 4 adult would be living with obesity or living with the consequences of obesity in the next coming years, and that is a very important thing we should keep in mind, because we are seeing now more and more people are putting on weight, and we are seeing a pretty big spurt in number of lifestyle diseases which are actually causing more damage to the health of the individuals. And when we are talking of individuals, we are talking of young individuals who are the productive source for the society or for that country. So when we see these young individuals getting prey to these type of lifestyle diseases and reducing their productivity, then it is a matter of concern.
So we all know that obesity is not just a mere cosmetic consideration, but in fact it's the leading cause to many chronic disorders. But do you think that this information and public also accept the same?
Still, I think public treats obesity at a very superficial level. They treat it as only a cosmetic phenomenon. That obesity is one big disease, and it leads to a lot of other diseases, has not impregnated into the minds of the general society. So when we see an obese person with any other medical problems, and we tell them that apart from treating these medical problems, you need to lose weight, very few people really take cognizance of that whatever we say and put effort to lose weight. So most of them take it very lightly, or they say that you are writing anyway 4 medications for my other diseases, write 1 more tablet which will give me weight loss. So that seriousness about obesity as a disease has still not come into the major part of the society.
Yes, doctor. I think I completely agree with you that the topic obesity is not taken seriously and not discussed openly. So what do you think the reasons for this could be?
So one of the reasons is that we are a very big country and we are very thickly populated. So the general public doesn't have much awareness of how much a disease burden an obese person faces. So when that is brought into light, I think maybe they will start understanding that prevention is better than cure, and let us not go into this cycle of putting on weight and then becoming sick. So that needs a lot of effort from every part of the society. It's not only the doctors.
So as obesity is not openly discussed among the general public, so how do you think we can tackle this?
So it's the young population. When we talk of young population, we should not miss the children, because now childhood obesity is picking up in a big way. We see most of the children are overweight and few of them are obese, and some of them are already morbidly obese. So childhood obesity has certainly bringing up its ugly head in our society, because earlier we were tackling childhood malnutrition. All our national programs were are directed at improving the nutrition of children, because they were not getting proper diet to eat. But nowadays we are again tackling one more disease where it's overnutrition, but bad nutrition. Overeating lot of bad unhealthy food is causing them to become obese and putting them in problem. So I think the younger population in coming few years, when we say world says 1 in 4 will suffer from obesity and its consequences, for India where we are still not very economically strong, and our young people are the backbone for the country for improving its economic conditions, I think these people should literally take obesity seriously and start working to keep it under check.
So I think that's a shocking fact that we jump from one spectrum, that is malnourishment, to the other spectrum, that is being overweight. So what are the treatment options available or that you could offer to your patients for this disorder?
See, when we talk of obesity, the first baseline will always be a well controlled diet and a regular exercise plus an active lifestyle, which is mandatory for each and everyone. If they are not able to control their weight with diet and exercise, then we have various medical and surgical options. When we talk of surgical options, we call it bariatric surgery. When we talk of medical options, we are not talking of medication, but for non-invasive procedures like intragastric balloons and endosleeves. These are helpful for people who need to lose maybe 10, 15 or 20 kgs. But when it comes to a bigger BMI, means someone needs to lose 50 kgs or 100 kgs of their excess body weight, yes, then there is no other go except bariatric surgery, which is a life-saving procedure for most of these obese people who otherwise would succumb to their obesity. So when science has so much to offer to help us treat these type of diseases, I think those who are already obese should use these methods of treatment to control their weight, and those who are not obese should definitely follow balanced diet, regular exercise along with the active lifestyle from preventing them to become obese.
So bariatric surgery, doctor. So is this a new concept, especially in our country, or it's been there since a while?
It's almost there for almost, you can say, 60 years. 60 years people in the West have been doing bariatric surgery. In our country, for the past 20 years, we are doing these procedures, and they are very safe procedures. They are a little alteration of the normal gastrointestinal surgeries which we do for other diseases, like we do for ulcer surgery or we do for a bowel tumor surgery. The same type of surgery with a little modification. When it is done for a obese individual, it's called bariatric surgery, and it is definitely a very safe surgery, and it is mandatory for someone who has a big BMI and not able to lose weight by their own or with any assistance in managing their diet and activity.
So doctor, when you suggest bariatric surgery to your patients, do you think they readily accept this, and if not, how do you educate them on this topic?
Yeah, when we talk of surgery as a treatment for obesity, lot of people are taken back. They think that it's only a little fat. Even if someone is a BMI 60 or 70, they will say it's only a little fat, and why should I undergo surgery for getting off this? Let me try. Nowadays your digital media is flooded with lot of fad diets, fad medications, and people just telling some easy ways that do this, drink this, and then you lose weight. So that is what is in the people's mind. The few educated ones and the few understanding ones, they come and get their surgeries done, but I would say still surgery is maybe less than 1% of the total obese population who is using the benefits of the surgery. For most of the other people, they continue to suffer with the obesity, and sometimes we get the sad news that this person hardly 45-50 years and has suddenly died because of his obesity. So people who are not using or not losing their weight by any means, we are certainly seeing a lot of mortality in these category of individuals. Now you can see every day, you hear in the news that young people suddenly for no reason are found dead. So most of these are sudden cardiac deaths which happen because of the excess obesity and the excess circulating fat and the stress what the heart and lungs bear because of this excess fat.
Undoubtedly, obesity is a silent killer, and not many people are open to discuss about this issue, especially with so much information available on the internet and people following fad diets blindly. So do you think this is a good idea?
I would say that when we talk of advancements in medical management, so medical management is a scientific process where every treatment undergoes a lot of stringent tests before it is applied to the general public. But whereas most of the fad diets are created by individuals who just think without much background idea of nutrition, they just think of some fad formulas, and then which may work for a small duration, and they try to propagate it much, and because people always want to use whatever is the easier technique, they fall for these fad diets. But in medical practice, everything is black and white. For every procedure, we know what are the good things what we expect of it, what are the problems which we can expect of it, and we are already always prepared for these type of problems if they can arise. But in fad diets and what we can say word of mouth hearings, there is no case control. So there is no one to take responsibility for your outcomes, and I would always tell the people, use medical services and use medicine as it is, and then you will get the good results.
So I think it's time we break barriers and discuss about obesity openly, and more importantly, accept that it's a silent disorder leading to many progressive disorders. So before ending this episode, doctor, what message you would like to give to our audience out there?
First, as a responsible citizen of the country, and also as a medical professional who has spent almost 2 decades in trying to generate awareness in the people regarding this obesity and the ways of tackling it, I would say that first, don't put on weight, and specifically for parents of young children, please control the diet of your children. Don't feed them on all these unhealthy foods which are nicely packaged, and allow them to exercise, allow them to play. Don't bind them to the books and home thing. And also for the young adults, please be active, please choose active way of living, and try to cut down all the high calorie foods who you people are getting tempted to. And then I would say that if someone is obese, treat obesity as a disease, like you would treat a cardiac event and how we do treat diabetes. Same way you should treat obesity as a disease, and use medical technology, medical services, and get rid of this deadly disease before it really conquers you. So I would say, on occasion of World Obesity Day, live a obesity free lifestyle, and this is a message for each and every citizen of this country and also of this world.
So thank you, doctor. It was wonderful having you here on the program today.
Thank you.
So this brings us to the end of this episode. Hope this episode was informative on the topic obesity and weight loss surgeries, and don't forget to join us for the next week as well. Until then, take care and stay healthy. Thank you.